Welcome to the lecture. Today we are going to take a sample question paper of GIC and understand the scenario that has been said in that. So with a visual representation photos, we can understand the scenario. So here the scenario is happening in quick shop, that is a small independently owned convenience store. So you can understand that is a store, and it is situated in a busy residential area, and it is established in 1995. It actually delivers a lot of everyday essential materials that is required, that has been provided by Quickshop. And also this store has now like a variety of products, including cigarettes, newspapers, and all the magazines, store cupboards, essential and all household items they are having. And they are also having extensive range of fresh organics delivered to the store daily. So the store timing is said is like 7 to 10. And now it starts the technical point. So it is saying it has narrow aisles that run between high shelves that are stacked with products and has tiled floorings. So you can see over here this statement. What it has said is that it has narrow aisles, okay, that run between high shelves that are stacked with products and has tiled floorings. Next, the store entrance is equipped with a small accessibility ramp to accommodate wheelchair users and those with other mobility needs. So people who require to have wheelchairs like to go, so there are these ramps being provided. So that is a facility support over there. Now it is saying the store also has a stock room, small rest area. It has welfare facilities like water, drinking water, toilet facilities, restroom, changing room, and all these things it has, and that is all located on a single level. So it has good welfare facilities that is provided. Now it says about the team, like they include, like they have a store manager, and then there is a supervisor. There are 10 full-time workers, and they work in rotating shift patterns. There are 4 part-time workers, and they exclusively work at weekends. And one of the full-time worker, that is the worker A. Now worker A is the main character over here. So that the worker A is actually using a wheelchair. He's a wheelchair user. He is a wheelchair user and has worked at Quickshop for like 10 years. So he's a very senior member from there. There is a cleaner that arrives at 6 to clean the store before it opens. And the SM, the store manager, like he is like he's seeing the deliveries, customer service, the general store maintenance. And when this particular store manager is unavailable, is not at the place, then the person who takes the responsibility is a supervisor. So this is a scenario over here. So yes, so now we have understood the basic scenario of Quickshop. Now we are going to the incident that has happened over here. So the delivery is regular delivery. is actually provided 9:50 in the morning. So here what has happened? There came a different driver over here, and he has actually been little late. So he leaves most of the like stocks on the back entrance. He unloads over there, and due to the time limitations, he's late, and due to his busy delivery schedules, so instead of leaving it in the backside, because the unloading people, they are like occupied with their work, what he does is he goes to the front entrance of this particular store, and there he takes the crate of the milk. There he takes the crate of the milk, and from the forward of the store, he takes this particular crate of milk and moves towards the refrigerator. Now he moves towards the refrigerator. Now here what happens is the milk was actually leaking over from the crate. The milk was leaking in the floors. So it was leaking completely, and he was unaware of that, the driver. So here the supervisor actually notes the spill. But before he could help, he could give an assistance. He go into the stock room to take a telephone call. Now at this same time of the delivery, what happens is worker, see, like this crate he was doing from the forward. Now what happens is the worker A, he actually, in this condition, the supervisor has now gone to receive the phone, the stock room. So he's now in the stock room. So worker A is also late in his shift, and when he enters, like the place from where he enters is a place where there is no customers, no workers, no one is there. It's like a no one is over there in this place. So he goes to the stock room to keep his like belongings and everything and come to the work. So here what happens is, in his way, he encounters with this spilt milk, and his wheelchair slips over there on the trial of that particular spilt milk, and he falls on the wheelchair onto the ground, and then his shoulder hits. So his shoulder hits the floor. Also, the worker A, now he fell and his head is struck with the corner with the nearby shelf, and it has also made a cut in his forehead. He is like not he's unconscious for some time. Later, what happened was he got some conscious, and immediately he shouted for help. So he shouted for help. So two nearby workers suddenly came over there to respond. One immediately goes to the stock room and alerts the supervisor, because here in this condition there is no SM. So supervisor is there, and he suddenly ended the telephone call and hurries to that particular scene. So when the supervisor came, he himself is a trained first aider. He got his like first aid kits and also instructs to the other workers, to another worker, to bring the barricade tape, like barricade cordon of that particular incident scene where the incident has happened. There he had instructed to do the barricade. So that particular scene is barricaded. So now when the supervisor arrives, it was seen that the worker A was completely bleeding from his forehead, and due to that, The customers who was there in the store, all of them rushed and they gathered over there in this particular scene. So this could make conditions more complex, and hence the supervisor had requested politely to all the customers to step back to give them privacy, and also they want to respond to the first aids and everything. And later, the supervisor had given, provided like a direct pressure on his forehead in the wound with a clean cloth and administered the first aid, and also carefully he has done the bandage on the head. Here the worker A also says to the his supervisor that he is unable to move his right shoulder. So these are such conditions when he cannot move it, which means there is some injury over there. So now the supervisor actually instructs a worker to get help, as because he cannot move the arms. So to get some support, so he brings some materials for workers a arm support, and also this same worker is been said to get the emergency support of ambulance and the emergency services. So with his phone, the worker instructs as per said by the supervisor. Now, the in the emergency service, the supervisor reports it is a head injury with visible bleeding and suspected shoulder dislocation, because in the we can understand that definitely he has got a head injury, and hence first aid is done. Bleeding was there, and also dislocated shoulder, because yes, there is an injury and hence he is not able to move his shoulders. So this possible things has been said. Suspected shoulder dislocation, understand that word suspected, which means not sure. So also the ambulance crew arrives to the place, and also this particular people instruct everyone except for the supervisor to wait outside, and also they give some instructions like don't allow anyone else into the store. The team of medic also confirms that his responsiveness and his head wound dressing, and also make sure that whatever injury he has is in his head, which is being given first aid. Is it proper? Like bleeding has been stopped? Yes, they confirm it. The bleeding is stopped right now. The dressing that has been done is beneficial. Then the worker A is then carefully transferred onto a stretcher and taken to the hospital. Then the supervisor contacts the SM, the store manager, to inform regarding this incident. The SM immediately arrives at Quick Shop within 15 minutes, and they starts the incident investigation over there. So the SM takes the photographs of the incident scene, and they also then instruct the workers to thoroughly clean that particular area, while the store also remains closed for around two hours over there. Now, the next day, what happens is the SM comes and he directly goes to the rest area, and there he has the accident report book. He updates it, and before that, the worker begins to arrive. So he speaks with all this individually. He speaks like what do they feel about this incident, and the SM listens properly and carefully regarding all their whatever they are sharing to them, and their thoughts regarding that incident, and suggestions how could we improve in the future regarding this, how could we control all such things in the future. So he does that. Also, SM is concerned about the workers' well-being. Also, he contacts their next of kin for an update. Now, next of kin is like a person's closest living relative or relatives. Okay, so he contacts. So also says his condition that he has suffered a fracture and dislocated shoulder, but thankfully, like he had no further head injuries has been identified. Like things are in control. So now, competent authority inspector visit. So here what happens is also the SM recognizes now the condition, the incident is meeting the criteria for a formal reporting. It is to be reported, and hence the incident is reported to the competent authority. To the authority, it is reported. Now, what happens is after a week later, 9, the inspector arrives for a scheduled visit in this particular place. The store manager greets him and also escorts to the places like rest area. The inspector like request. So what in the beginning when this inspector is coming, like he is requesting to the SM to show all the health and safety documentations for the store. So all the documentations regarding health and safety he was saying when the inspector visited, he has not gone to the like he had main focus in his documentations. Then the inspector sees that the health and safety policy is like pinned, is like put in the notice board, and he noted that it is dated from earlier in the year only. So that was a good sign that has been shown. And also the store manager said to the inspector that the policy is also shared to all the workers during their induction. When they come in the induction itself, it is been shared to them. Also, the inspector then reviews the risk assessment for the store. So, induction, when the worker comes, they actually gives the induction. So, all the information is now with the particular workers, so they have the knowledge of that. And as said, the inspector like checks the risk assessment, and it is also like updated for 2 months ago also. And in that also there are like a good amount of suitable controls that was there for the slip, trips, and falls. Just think if the floor is like slippery, like wet, if a person could fall by slip, they have the whatever controls is required, they have it over there. So that was a like positive thing over there. So, but the inspector here now sees that the in the risk assessment it was good, but still the hazard outside the store and also near to the back entrance, this both places they have not included in that. It does not include in hazards are not included of that. Also, then the inspector what he does is of the quick shop, they check the training records. Now the back side and as we said, like the store outside and back of the entrance, they had not included the hazards. So later now the inspector when he checks like the training records, it was found that they have a like record of like giving training records to the workers for like full day induction that has been taken by the store manager, and also detailed tour of this particular store is been given, and that is a 2 day, like a 2 day followed role specific training with experienced workers. So they cover all the covering tasks such like stocking shelves, how it is to be done, stock replenishment, how it is to be done, cashier duties and unloading deliveries. Everything is been shown in this particular days. And here he found that there are like 15 workers training folders are there over there. Also, this inspector now he examines and confirms that worker has been trained. So the worker has got all the required trainings and everything. And the refresher training is also be got. They have been delivered. The quick shop team management. And the inspector is also pleased to see records of basic training in first aid procedures. They had given the first aid procedures, the fire safety, okay, the first aid procedures, the fire safety, and also emergency protocols that is to be followed. So all these things, they have a folder also, documented thing. Now the inspector is asking that he wants to see like the accident book. So now when he sees this particular book, it is seen that there is no previous incident or uh, record previous incidents recorded, but there are some like near misses over there that has been that like there are near misses that is recorded, documented. Also here the store manager confirms like he had done the investigation for this particular near misses that has happened, and also the store manager discusses this with the workers themselves who has faced that, and identify the causes like why it has happened, and also agreed like preventive measures what could they do to stop or control all these things. The store manager also tells to the inspector that the daily briefings is also been taken to the workers to express the concerns that they have, and also what we want to see to them, like a communication is good over there. So now the inspector is also preparing to like visit the store, like a tour. He checks. While he was going, he pauses to like a notice board, and he sees a review of a copy of the workers' handbook. Now, workers' handbook is also reflecting a good positive culture over there. Now, the store manager also says that every worker is actually receiving a copy of this during their induction. So they receive the copy also, the worker. So the note in the notice board, the inspector reads also the list of like first aiders and the first aid locations where it is, like the fire wardens details, who all are they, there are details and everything. So where is the evacuation routes, the fire extinguisher placements, where are all these things. So all the emergency preparedness things they had made sure that there are there. And also in the whiteboard there was an outline of daily morning briefings that is taken by the store manager. So now what happens? Now at the end of the visit, now the visit is coming to an end. The inspector is thanking to the store manager for cooperating for the time, expressing satisfaction with the documentation. They are satisfied with the documentation, and safety measures are like good, or safety measures are there in place. So this has happened, and later what happened is, after the incident. Now after the incident, what happens is, so following the incident, what is happening is the worker A, he is actually like hospitalized and in treatment and observation for around and he spent for 10 days over there. Now, he has spent 10 days over here. In this particular time, other workers they had it to do like overtime because worker A is not over there, and they have to do overtime till there was a replacement or another person was hired in that particular place. and he worker A was unable to return to the work. He was not able to return to work for around like 6 months due to this particular incident that has been faced. Here, what the worker A does is he filed a claim against the quick shop that he claimed a file. To the quick shop, and as a result of that, the store has was ordered to pay a substantial amount in compensation. So compensation was given to him in this case that has happened. So he gets the compensation. So this is the complete scenario of this. Now let's check the questions. We are taking this only to understand the concept, what it is asked, the technicalities, only just basics. Now the first thing that is asked, task 1, uninsured cost. What would the possible uninsured cost be for quick shop for the incident? Here remember, you should only have to say the uninsured cost, understanding the scenario, or what all things you can find in the scenario of that particular thing you should have to mention over here. Uninsured cost. It is said from the scenario you use it and write the answer. Then second task, health and safety management roles and responsibilities. Comment on what a store manager is doing well to help ensure roles and responsibilities are carried out effectively at quick shop. So store manager, like his roles and responsibilities, how you should have to comment, like what all he is doing well, for his roles and responsibilities, what all is he's doing effectively at quick shop. You should have to mention that roles and responsibilities. Then moral reason for managing health and safety. Here, discuss the positive and negative aspects of quick shop moral approach to health and safety. In the quick shop, their moral reasons, like you should have to mention the moral reasons uh, that they were maintaining for like health and safety, like the moral obligations and moral ethic, good practices, humanitarian practice that they were doing. That positive things are also there, so you should have to mention that, and here negative things are also being asked. So you should have to find out in the scenario and write down both the things. See, here in the first question, it is of 12 marks. Here, if your 12 points are different, you can elaborate it properly, make it like good. All the 12 points are different, then you can go like 12 to 13, 14 points. Uh, so that would be great. Okay, make sure like more amount of points has been added, like how much you can see in the scenario, that much you can add it. Okay, so same like this, followed like this thing only. If just think the points are getting like you are taking 1 point and that point is explained like for 3 to 4 points, so in that cases you should have to make sure more amount of points is required in that scenario. Okay, now you should have to mention positive and negative cultures. So half of, or like how many positives you had found in this particular scenario, you should have to mention that. How many negatives you have found regarding the moral reasons for like managing health and safety, you should have mentioned that. Now determining the benefit of inspections. How could carrying out regular health and safety inspection benefit quick shop? You should have to say over here that by taking like just think if there uh, a regular inspection for health and safety has been taken, so how will it benefit the quick shop? So you should have to like write that answer, how it is going to benefit them. Remember, all the answers should be like relating to the scenario only. Now fifth task by incident investigation. What are the immediate causes of the incident? What are the root causes of the incident? By seeing the scenario, you should have to write the immediate causes and also the root causes from the scenarios only. In emergency procedure, why is it important to practice emergency procedures. You should have to write that. Here it is not asked to give answer from scenario, so you can elaborate it. You can add your knowledge over there, your experience over there. Like when emergency procedures, why is it important to practice emergency procedures? It could be regarding this condition, this situation. Also, we can say. Uh, Okay, you can find here in task 6, they are not asking. To all the rest of the questions, their scenario is asked. You should support your answer where applicable using relevant information from the scenario. But for everything, it is asked, every question, but only for this, it is not asked. So it is like a general question. You can elaborate it in a very good way from the scenario also. Also, the experiences and knowledge that you have. So all the things that you have learned, have understood, put like how, why is it important? You can write over here. Now, task 7, that is about indicator of health and safety. What are the positive indicators of health and safety culture at Quick Shop? Here you should have to, as per the scenario, what all positive things, positive indicators of health and safety culture, like good health and safety culture or like positive health and safety culture, what you have found in this particular scenario, you should have to mention all that things. So see here, it is 16 marks, it is there. So you should have to put a lot of points, all the points, whatever you should have to find each and everything. Note down each and every words whatever is there regarding that shows positive health and safety culture, and make it implement in the points. Write down like that. The last is task 8, management of risk. What are the strength of Quick Shop's approach to managing risk? So in the potential, like they are controlling the risk or they are like managing the risk, what all strength can be seen in their approach to manage risk by the Quick Shop? As per scenario, you should have to find that and you should have to do it. So this is the uh, scenario and its question what it is trying to ask. So here only just for guidance is to understand like what is the concept or what the question is. Just a guidance is to be given. So here we are stopping this. So wishing everyone good luck. Thank you.